Australia's Women's Health Week has just passed. As a Canadian gynecologist who did fellowship training and a PhD in Australia, I have some thoughts on the difference between the Australian and the Canadian health system for women's health issues. My name is Dr. Matthew Leonardi. I'm a Canadian gynecologic surgeon and sonologist at McMaster University in Hamilton, Canada. The first, Australia places an emphasis on the diagnosis of endometriosis like no other country. This is partly why I went to Sydney, Australia to learn how to perform advanced gynecologic ultrasound to diagnose and map endometriosis. There are clinics all around the country that are focused on gynecologic ultrasound with expertise in the performance and the interpretation of the ultrasound. Australia has a national action plan for endometriosis. It was one of the first countries in the world to establish this. A national action plan creates awareness, it raises educational standards, and it endeavors to improve the clinical outcomes of patients who are suffering from endometriosis on a daily basis. Canada could definitely learn from Australia on their national action plan. And finally, Australia has really established a strong interdisciplinary approach to endometriosis in their public healthcare system, involving services such as pelvic floor physiotherapy and psychotherapy in a covered fashion. Patients do not have to pay out of pocket for these services, which is still the norm in Canada. Moreover, there are interdisciplinary endometriosis centers that are being developed across the country in a way that makes the care pathway for patients easier. Endometriosis is a very difficult disease to have, and navigating the health system can be very challenging. So, putting all services in a single location in a way that's supportive of the patient's journey is the way we must go. Australia and the Australian health system taught me so much more about gynecologic and women's health. And I'm so proud to have had an opportunity to learn from that model of care and bring novel ideas and innovations to the Canadian landscape. Hopefully, one day, some of the things that we're implementing here in Canada might be learned by our colleagues down under, and we can enhance the care of endometriosis patients globally.